There are a number of things that can cause Achilles tendon pain, and in this video we run through some of the things that can be contributed. Firstly, insertional tendinopathy, mid-portion tendinopathy, fascia cruris tears, plantaris tendon issues, paratendon issues, and sural nerve involvement. First up, the most common cause of Achilles tendon pain is either mid-portion tendinopathy or insertional tendinopathy. Mid-portion tendinopathy is more common at 55 to 65% of all Achilles tendon injuries. The location of pain is the biggest telltale sign here, and you can see this image on the right-hand side. Mid-portion tendinopathy is felt a bit higher up at this letter A, whereas insertional tendinopathy is lower down. Insertional tends to be worse on high ranges of dorsiflexion. That's like doing a calf stretch. They tend to be a bit more difficult to manage, and a heel lift can be really important for these. Next up, we have a fascia cruris tear, and the fascia cruris is a layer of connective tissue that basically wraps around the structures of the calf and attaches down to the ankle joint, and also attaches into the Achilles Paritynan and may have an involvement in Paritynan issues. Clinically, we tend to see a rapid onset of swelling and tenderness felt over the inside or the outside part of the Achilles tendon, and this is often preceded by days or weeks of tightness felt in the calves. We use ultrasound to confirm this diagnosis, and management is like we would do for a normal soft tissue injury. Partial tears of the Achilles are not that common, with 8% in partial tear and 5% with an intratendinous tear in all those with Achilles pain. Clinically, we find that those with tears can often jog without discomfort, but then they lack that ability to push off at higher speeds. We tend to use imaging to diagnose with either ultrasound or MRI, but there are questions on the accuracy of these imaging. The plantaris tendon is pretty much present in everyone, and it's a matter of whether or not it's wrapped in with the Achilles tendon, as you can see on this image. End-range dorsiflexion, so that's the toes pointing up towards the head and stretching the calf, and rear foot valgus can create compression of the Achilles tendon and the plantaris tendon. Bend sprinters are particularly affected, predominantly on the right leg, which suggests that there's a mechanical interaction between the plantaris and the Achilles tendon. Those with plantaris tendon involvement tend to feel pain more on the inside of the Achilles tendon, and it also tends to be a little bit higher, whereas those with mid-portion, they tend to pinch the tendon. You can actually palpate the plantaris tendon, and starting at the muscle tendon junction of the Achilles, and just feel on the inside of that. A normal thickness is only a few millimeters thick, whereas when it's irritated and problematic, it can increase to as big as 8 millimeters. You can also use a stethoscope to listen for the crepitus between the plantaris and the Achilles as they friction against each other. Positions of dorsiflexion tend to compress the plantaris tendon, and so in this way it behaves more like an insertional Achilles issue. Pain initiation on a calf raise, so you can get standing on a board and raising up from this position, also tends to aggravate it. You can differentiate the plantaris tendon from an insertional by the location of the pain. So an insertional tends to be felt down the bottom, whereas plantaris tends to be felt higher up and on the inside of the tendon. These patients tend to feel worse when barefoot due to greater dorsiflexion. The way that plantaris is managed is similar to an insertional Achilles tendon, so we want to avoid high ranges of dorsiflexion. So using a heel raise, even up to 12 millimeters, and shorten the stride when walking to limit the compression of the plantaris. Research on treatment is mainly with surgery, but it can be helped conservatively. The Paritynan is a wrapping that surrounds the Achilles tendon. Those with Paritynan issues are often worse on slower movements, so things like calf raises, versus energy storage and release activities such as hopping or running. A good treatment for Paritynan issues is to apply half Voltaren, half Puridoid cream, slather on, wrap it in Glad Wrap at night, and do this for 7 nights in a row. Those with sural nerve involvement tend to feel more pain on the outside of the tendon. Pain can also refer down into the foot along the path of this nerve. You can palpate the nerve, and a normal nerve will not be painful. Tinel's sign of tapping the nerve is not reliable for this. However, neurodynamic signs like a slumps test can be used. Sural nerve irritation may also be linked to the presence of a third head of the gastrocs.